It can be very hard for anyone to reach out for help, and for Indigenous women, for many reasons, it can seem especially daunting. Talk for Healing, a newly expanded helpline, is now answering that call in 14 Indigenous languages. Here to tell us more, Robin Haliuk, Program Supervisor at Talk for Healing, and Dr. Dawn Lavell-Harvard, President of the Board of Ontario Native Women's Association and Director of First Peoples House of Learning at Trent University in Peterborough. Great to have you two here with us tonight, here on TVO. Thank you very much. Dawn, get us started. How did Talk for Healing get started?
Well, this is something that really came from community demand many years ago when our women were talking about communities that had little to no services, and it just wasn't economically feasible to be able to provide on-the-ground services in many rural and remote communities. But this is a way for our women to be able to reach out, to access some support in a way that's discreet, that's safe, and no matter which community they're in.
Robin, why specific to Indigenous women?
Talk for Healing, we want it to be culturally responsive. We know that often mainstream services don't meet the needs of our women. They might feel threatened. The impacts of colonization and all of those generational traumas that have went with mainstream service providers are still very real for many people. And those impacts stop people from getting the help they need sometimes. And so having a service that is Indigenous focused, that is culturally responsive, that is Indigenous women helping Indigenous women is just so valuable, and it builds that trust that much quicker.
I would think that for that kind of very specific, specialized service, you would need a heck of a lot of training to be, the right person on the end of the phone, as it were.
Absolutely. Our staff team is an amazing group of Indigenous women that most of them have been with the program since we launched back in 2012, October 19th, 2012.
How many people are you serving?
I don't know the complete population for Ontario, but I mean, as far as the Indigenous...
No, I mean, how many women use the service?
We've had probably close to 20,000 calls in the last 6 years.
20,000 calls?
Absolutely. Individual contact. Calls will last anywhere from 15 minutes to over an hour sometimes,
What's the nature of the calls?
It can be anything from very often women who are in a violent relationship, who are reaching out, trying to find a way to escape that relationship but don't know how to do that safely. And this is where this is really important, because through this helpline we can have our women get support to develop a safety plan. So we know, unfortunately, that when a woman makes a decision to leave a violent relationship, that is the time when she is most at danger of really severe and life-threatening violence, because that's if the abusive partner feels that she is about to leave, then that's when sort of no holds barred attempt to regain control of that relationship. So it's really critical, and that's very common, tragically, and unfortunately one of our very common reasons why women call is they're reaching out because they are really in a point of crisis and need some help to escape that relationship.
Understand that, presumably they need something a lot more than just a sympathetic ear offering advice at the other end of the phone. So what's the next step, the concrete step that you can take to get people out of those harrowing situations?
We can actually direct link. So what we found is 90% of our calls actually aren't looking to leave a relationship. They just want support in staying safe within that situation. And the realities of safety planning with somebody in a northern remote community are very different than somebody in an urban community. So understanding that there isn't a local shelter, there isn't a road to go anywhere, that the next flight might be whenever, or that lateral violence that also happens within a lot of northern communities as well, in not being able to access services at the band office, or not being safe to disclose what's going on within a home. So we become that lifeline, and we talk about safety in a different way, because even though the automatic thought would be, well, you need to leave, that isn't always the safest option. And so understanding that, and understanding how we safety plan for somebody that doesn't have services very differs.
Well, that's fascinating, because if the best option at that moment is to leave, and there is no means of transportation, there is no road to get you, there is no flight to get you, What do you do?
So, I mean, that might mean connecting with nursing stations. A lot of communities have mobile response teams that have, key community members that have been supportive, trusted community elders.
And you put them together.
And we try to make those linkages. Also, it might mean just staying on the phone and supporting a woman with where she's at until kind of things mellow out. And we've done those things. We support women with where they're at. And there's no judgment involved in that. It's just about being a support and being that lifeline.
You've heard the phone calls? You both heard the phone calls?
I supervise the helpline, so I'm very well aware of the phone calls that come in. Everything from grandmas to young girls, everything from parenting to just supportive listening, problem solving, addictions, all really wide variety. We also end up fielding about 20% of our calls suicide.
Well, here's
and I think that's the biggest thing too, is that when the women are calling, because it's discreet, because it's confidential, it's not the same as, it might feel the same as having a supportive auntie or trusted friend or mother who's there to help you, but you don't risk that retribution in the community. You don't risk that judgment, especially if you're reaching out. If there is challenges with drugs or alcohol in the family or violence, then you're not putting your family, or you feel you're not putting your family at risk by disclosing. Precisely, thank you.
I don't want to make any assumptions here. Do men ever call?
Absolutely.
They do.
I always joke that our first caller was a male from Nunavut. So when we launched back in 2012, our first caller when the line went live was a male from Nunavut. So
what was he calling about?
He was actually tweeting about it, had heard on APTN that we were launching and wanted to see if it actually worked. And we were like, hey.
He was testing.
He was testing out the service.
I see.
But
So
we do have male callers. We realize that there are limited services for men as well. We are a no wrong door service provider. So we may not be the appropriate service, but we're going to try and support you in that moment and try and connect you to resources that might be more appropriate.
And I presume everybody on the other end of the phone is female.
Yes.
That is the case. Okay.
That is the case.
You want to bring this picture of the website up? Let's do this, Sheldon. Have a look at that. Now, in the corner are two links which you traditionally do not see. Hide this page and cover your tracks. Why are those there?
In cases of domestic violence, often there are stalking behaviors. We know, like Dawn had said, the highest risk time for lethality within a relationship with women fleeing violence is when they choose to leave. It's finding something like, in a web history, somebody finding that they're looking for resources or assistance for a situation where they might be thinking of leaving a relationship could put a woman and children at risk. So this is, we ask people that visit our website that may be fleeing violence that, use those buttons, clear your tracks, make sure you're keeping yourself safe.
Right.
So.
14 Indigenous languages you offer.
Yes.
14 languages. But I assume most people call in English. Is that right?
Yes.
They do.
So up until the provincial expansion, we only offered services in English, Ojibwe, Ojibwe, and Cree. And since the expansion, we've expanded that because we realized there are a lot of Indigenous languages represented through Ontario. So we can offer support through linguistically, through translation services for some of the expansion. Most of our staff do speak either Ojibwe, Ojibwe, or Cree, though. And they have actually managed to fumble through calls in Odawa, just based on the linguistic characteristics that kind of carry over.
I was going to say, Don, because I remember we did a program at Trent University where you're stationed, and we had guests on the program who were from the Indigenous community who were kind of, extremely upset about the fact that these languages are disappearing, and that, the notion that you could call a helpline and have somebody speak in as many as 14 Indigenous languages. I would have thought that there weren't even be that many people around who could speak that many different languages who could be helpful, but they can.
Well, actually, as you were saying, is that our services really do cover that life spectrum. So there are, elders who are still, English is their second language. And even though they might speak quite well in English, it is still their second language. So when you're in a moment of crisis, or when you're really trying to articulate those sort of innermost emotions and feelings, it can be really hard to have to think them in your original conceptual language and then have to translate it. And then when you add stressors and trauma and all of these other things going on, it's much better for them, and they're better able to articulate what their needs are and what the concerns are if they're able to speak in their first language.
Well, and there's
it helps prevent miscommunications as well.
And there's healing in being able to tell your story in your language, and that's what we're about. We're trying to be that bridge to start that healing process. So sometimes there's so much healing in just being able to tell your story about what's going on in your life. And without that judgment, without that, just be a supportive voice. And so being able to say that in your language. We've had one of the stories that I like telling is about, you know, when we had elders brought down to Southern Ontario and when they were doing the Truth and Reconciliation stuff. And, you know, we never realized the impact of an elder going back to a hotel room that evening and then the impacts hitting. So as much as support services were offered through that process and counselors were on site and all of those things, this elder went back to their hotel room and they didn't want to call family back home. They didn't want to burden the family any further. They used us. And so being able to tell their story in their language and process what they had been through that day, reliving that trauma, you know, it was so valuable to them.
What's the most number of languages one of your people on the phone can speak?
Most of them speak only 2 languages. So what we do is we subscribe to a translation service to support kind of the other ones. We are located up in Northern Ontario. So predominantly in Northern Ontario is Ojibwe, Ojibwe, and Cree. So finding people that might speak Odawa, Algonquin, up in Thunder Bay or up in Sioux Lookout or up in around the regions of Northern Ontario would be really difficult for us.
And what's the longest any phone call has lasted? Any sense of that?
I think probably our longest is close to 2 hours.
2 hours on the phone.
Yeah, I mean that might have been dealing with a crisis situation that we suicide. You know, we're not dropping a call for nothing. If we've got somebody that's life is in danger, you know, we're going to keep them on the line. We're going to support them through what they need to, you know, get help on the way. And getting help to somebody isn't always easy either. You know, when we talk about northern communities.
Can you say for a fact that this has saved lives?
Absolutely.
Absolutely.
You've talked people out of killing themselves who are calling in incredible distress.
Absolutely.
You have. Yeah. So what are your plans for growth? Who wants to take that on?
I can take that on.
Absolutely.
Well, as we expand as a provincial provider, we've now offered, initially when we launched, we were just a phone line and a toll-free phone line that worked across Northern Ontario. With this expansion, that's allowed us to broaden our catchment to all of Ontario. We've also now included text and chat. So chat is a portal through our website, and which is great for our younger demographics. We know that the younger generation isn't wanting to pick up the phone. They're not wanting to pick up the phone. They prefer text and chat, and so this allows us to keep those young women safe. Also, it's a safety concern. You can quietly text in a bathroom, whereas if you actually pick up a phone and are actually talking to somebody, it's pretty obvious you're talking to somebody. Yeah. So this could actually, it becomes more safe for many people to reach out for help.
It's very discreet.
Yeah, absolutely.
What's the budget?
Prior to the launch, to the expansion, it was a $500,000 budget. Now we've moved to $1 million operating budget. So we're excited to be. I mean, we've had to increase our staff team by 2-fold, which is exciting. We have an amazing group of women that work the line around the clock and work diligently to support those callers.
Is that budget secure?
As far as we understand, it is. It is permanent funding, so.
It's funded by the Government of Ontario?
Ministry of Community and Social Services, yes.
You may have heard that they say the deficit is $15 billion this year.
Well, so this is something that we're really hopeful that, you know, as everybody knows, when it is government funding, there is no guarantee when there is a change in government. But we're hopeful that the current government really sees the value of this particular investment, because we know that when you invest in the women's safety, that support for the women, for their families, and keeping those families together and helping to avert crisis, helping to intervene at an early stage in the process, you know, with these kind of preventative supports, actually saves significant amount of money in the long run if we're avoiding children having to go into care, avoiding incarceration, avoiding, you know, hospital stays. There's so many ways that this kind of early intervention helps to avoid significant cost to the government when they are only intervening when things come to a crisis. So we're hoping that the current government, we're very hopeful that the current government can see that this isn't just the right thing to do, that this is in fact a very smart thing to do in terms of investment of taxpayers' dollars across the province.
Absolutely. And when we launched back in 2012, we were under a 3-year pilot project. Under that 3-year pilot project, the policy analysis branch through the ministry also reviewed our program and the outcomes. They reviewed our implementation and the outcomes. They saw this was such a valuable service. So we have the documentation to support that this is a valued service, that we're offering quality service, and the need is still there. Have you met with the Minister of Community and Social Services yet?
Not yet.
Have you met with the Minister of Indigenous Affairs yet?
We've had some phone conversations. We are in the process of arranging for our meeting, so we're again, hopeful that we're going to have the opportunity. And the numbers and the quality of our service really does speak for itself. So when they do look into this, they are going to see that we are, in fact, having significant, huge impact in community, having amazing results from what is, given the scope of the challenges that we're working with, and actually quite a small investment in terms of the scale of the operations and what we're achieving with that investment.
I don't want to take anything away from you, but you know that when budget-cutting exercises happen, and there's every indication that's about to come, they don't necessarily look at who's doing great work, who's doing lousy work. They just say, okay, everybody, 10% off your budgets, go right away. You prepared for that?
Absolutely. I mean, we are, as Indigenous women, we have been used to tightening our belts and making do with less for hundreds of years now, certainly, since the inception of the Ontario Native Women's Association. So, we would be confident that even if there was cuts, that we would still be able to provide quality service. Again, we just hope that there is still that understanding that this is a quality service and that there wouldn't be any sort of
decline in service,
cancellation and decline in service that would put families in jeopardy. But come what may, we will do our best to ensure that our women and their families receive quality service.
Okay, a couple minutes to go. I want to ask you, the Missing and Murdered Indigenous Women's Panel, the National Inquiry, has been a bumpy road so far, to say the least. Although they say they are going to wrap up their work fairly soon, and I wonder what hope do you have for the conclusions, for the outcomes that inquiry will come to? Go ahead, Don, you first.
So with the inquiry, I think what they're going to come forward is a lot of things that we on the grassroots have known for a long time. A lot of those concrete ways in which the system is putting our women and our girls in danger, whether it be the justice system, whether it be the child welfare system, whether it be the health system, the education system, because this really is about systemic challenges for our women. And so, even the recommendations we have submitted are really looking at recommendations for systemic change, to increase quality of education, to increase access to services, and that is going to help our women improve their safety, their level of safety. Because we know that poverty is really tied into this, that the level of safety you can access in society is intimately connected to the amount of safety you can purchase. When you're in a community that has no transportation, that has no public services in those ways, your own income is really connected to your options in terms of transportation and these kinds of things, which we know is a really key factor for our women when they do go missing. So, with the inquiry, we're hoping there's going to be some really solid recommendations. We know that a lot of the people who have been speaking to the commissioners have been talking about those systemic issues. And so we're hopeful that it isn't simply a reporting of what we already knew, which is the horrific and terrible tragedy that these families have faced. But we're hopeful that some of those recommendations coming forward will be future-looking and action-oriented so that we can, with any luck, really start taking action, start implementing those next steps that need to happen.
How hopeful are you that something positive will come out of all of that?
I'm hopeful that, again, the recommendations will be, some key findings and move forward with that. As a service provider, no matter what those recommendations are, we're still going to be there to offer support to families, to women, to children, to people experiencing violence, at risk to be experienced violence. And at the end of the day, no matter what the recommendations come out, no matter what kind of comes out of that, we're there to be a helpline and a support for women.
In which case, we probably ought to give the phone number.
Absolutely.
You want to give the phone number?
It's 1-855-554-HEAL.
Yeah, that's it. H-E-A-L. HEAL, which
Yep.
makes sense.
Yes.
Yeah. 1-855-554-HEAL.
And it is text enabled. So if
Text enabled
you
as well.
prefer to text, absolutely give us a text or pick up the phone.
Great. Robin Haliuk
Yes.
and Dawn Lavell-Harvard, who's a PhD, but not from Harvard. That's actually your name. We got it. Thanks to both of you for coming into TVO tonight. Appreciate it.
Thank
Thank
you.
you very much for having us.
The Agenda with Steve Bacon is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.